Today, I'm Jody West. I am the provider-to-provider consultation line program manager and the coordinator for the ECHO session. So I kind of manage everything behind the scenes. But this is our agenda today. We'll do three brief introductions, then a didactic presentation will be given by Dr. Paula Zena about infant massage. And then Yasmin Welch will present our case presentation, and then we'll have questions and recommendations. So we're going to do our best to get through this in a timely manner. But I want to introduce myself again. I am the coordinator of ECHO, but for the provider consultation line, we are a no-cost statewide mental health care access program, consultation program. We do part of our program, our trainings, which is what this is. We also have a pediatric training, ECHO series, but providers across the state, whether you're a medical provider, mental health provider, work in schools, anything like that, can call us to receive guidance or just discuss resources in your community. And we can also link you to a psychiatrist if you have a question about medication for treating your patient that may be coming to you for things that may be a little bit out of your comfort zone. So this is if you scan this, it'll take you to our website, and this is our phone number, Monday through Friday, 8 to 4:30. But I'm going to go ahead and give it over to Dr. Olivier, who is our facilitator.
Thank you, Jody. Good afternoon, everyone. I'm Dr. Olivier over here in Lafayette, Louisiana. I'm over here in private practice. I'm a psychiatrist, also a perinatal psychiatrist. And I just want to thank y'all for joining us again today for this next round. I'm going to go ahead and reintroduce our hub team of experts to y'all. So you can just be familiar with who's going to be kind of inputting their expert opinion on the case in the presentation. You already met Jody West, who is also LCSW, who is going to bring in her expert opinion from the social work aspect. And she's also our program director. Dr. Zena, can you introduce yourself to us?
Sure. I'm Dr. Paula Zena. I'm a clinical psychologist and also a pediatric nurse, and I represent in part on this a nursing perspective in perinatal mental health.
Yes, Dr. Zena, you wear many hats. You're presenting today. So
I'm a mother and a grandmother too, for that matter.
Excellent. Expert opinions.
That's excellent. Give me expert opinions, right?
So Katie Aber is out today. She's also one of our other social workers that y'all are used to seeing on this call. And then Dr. Finelli, you want to reintroduce yourself too?
Sure. Hi, everyone. Sorry to be a little bit late. I'm actually out of town joining. I'm Juliana Finelli. I'm a child psychiatrist and general psychiatrist, and I work with the perinatal side of PPCL as a psychiatry consultant. So thanks, everyone, for being here. Good to see everyone.
All right. Thank you, Dr. Finelli. I think that's everyone on the hub team. You're also going to see Lena and Sienna in the background helping out with IT stuff too. So thanks for y'all for being here. We're going to go right into the didactic presentation for the next 20 minutes. Dr. Zena is going to present on the benefits of infant massage. So go ahead, Dr. Zena.
Unmute myself. Yes, thank you very much. I'm really happy to be talking about this topic today because I think it's something that is just right there available for us to use, and sometimes it gets kind of overlooked as something that's really truly beneficial for the baby and the mom and for the dyad. Can we go to the next slide? Here are the objectives. I'm going to talk briefly about how infant massage is helpful for infants and maternal mental health and mental health for that matter. How infant massage can really improve or help the dyadic relationship, the relationship between the parent and the child, and also think about how we might incorporate it into perinatal services. I don't have any conflicts of interest to disclose. I have been trained in infant massage through the Loving, I just forgot the name of it, but anyway, and so I've had a chance to do this with both with my children, with my grandchildren, and with patients and families, and so I'm excited to talk again about it. And I'm recognizing a few people who have heard some of this before, so for those who've heard some of it before, you just have to kind of bear with me. Okay, next slide. Okay, so why massage? Why are we interested in it? Well, first of all, we know that babies, when they're in utero, they're moving around and they are getting lots of physical stimulation through the pressure of the uterus on their little bodies as their bodies are growing. So they're already getting used to various kinds of touch on them. We know that the skin is the first sense organ to develop and also the largest organ in the body. And the skin has many uses. It's for thermoregulation, helps keeps us cool and warm. It's protective for allowing intrusions into our body. There's an immune function, lots of different important functions of the skin. But this one particular article that I found by Morrison, and these articles that I'm going to be referencing are on the reference list of the slides that you will get, is thinking about skin as a social organ. And when you think about skin, it's one of the first ways that we connect with our babies, right? I mean, we touch the baby, we talk about how soft their skin is, we talk about how good they feel to touch and so forth. And it's really the beginning of that affiliative behavior that we're talking about, that interaction between the infant and the caregiver. We also know that the type of touch can moderate affective processing. So harsh or rough or gentle or soothing, all those different kinds of touch can impact emotions and affect. And it's also a way that young infants begin to develop that inner subjective representation. In other words, what is it like to be this particular caregiver in the way that person is touching me and so forth. Massage is not a new thing. It's not some wild flaky type of thing. It's been around for thousands of years. You can see evidence of its importance through thousands of years. And Hippocrates, and when I found this particular quote of his, but man, he has some incredible quotes. If you ever just want to go check out the Hippocratic quotes, very, very wise man. And he said, anyone wishing to study medicine must master the art of massage or the art of touch. And so I just want us to bring us back to that laying on of hands in general can be very, very healing. And we know that, again, massage for infants has been practiced, again, for thousands of years, first described in India, but BCE is before the Common Era, or BC. Next slide. A little background here. I think it's interesting to look at what we can learn from animals. And there's certainly a large literature out there. I'm using a lot of work from Tiffany Field, who I will speak about later, but she is kind of the premier researcher in terms of infant massage, and she has this particular resource as a summary. And two things that she pointed out that I thought would be of interest to this group. One is studies on rat licking. So people are studying rats. Not my favorite animal, but looking at rats and how they raise their young. And studies have shown that when you compare baby rats who are licked by their caregiver, their mother, versus removing those babies and not having them have the advantage of being licked, the babies who've been licked have higher antibodies, they have greater weight gain, they're less anxious, more resilient to stress, lots of behavioral and physical advantages when the baby rat has experienced licking. Similarly, in Harry Harlow's work, and some of y'all are probably familiar with Harry Harlow, Learning to Love, the monkey studies. What he found was that, and some of this work is controversial, I have to say, we probably couldn't do it today, but still very, very influential in our understanding about what babies need in terms of their interactions with their caregivers. And he found that when he compared infant monkeys who had access to a wire monkey mother, but covered with a cloth, compared to the same type of wire monkey mother that had milk, but not the cloth, they found that babies under stress would turn to the mothers who were covered with a cloth over and above the infants, the wire monkey mothers who had the milk. Make sense? So that touch was really, really important. And they found that even if these baby monkeys could see, hear, and smell their mothers, but couldn't touch them, their immune systems broke down. So pretty impressive information. And he talked about the need for contact comfort in these young babies. Next slide, please. I was trying to do it myself. Okay. With babies, I think this is, I remember when I heard about this first study, some of you all might have heard this before, I was sort of shocked and appalled by the whole thing, but King Frederick II of Germany was very interested in how language develops. I mean, it is a fascinating thing, how babies develop language. And he decided to do an experiment where he separated infants from their caregivers and had them cared for by a nurse. And I'm going to put that in parentheses because I don't think that's what a nurse would really do, but where they couldn't talk to the baby and they couldn't touch the baby. And what he found was that the babies who were put in those conditions, all of them died. So this is back in the 1200s. This is a long, long time ago. So the issue of just sort of that kind of care has followed, that little study has followed us for centuries. We know that even when babies were put in orphanages or nurseries back in the 18th century, 19th century, when we just began to have orphanages, the babies would die from malnutrition, but it wasn't because they weren't offered food. It was because they were withdrawing and not interacting and not withdrawing from interaction. We know, I'm not going to read all of this, but you can see that again in orphanages, even as late as the 1920s, high rates of death for babies, even though they were being cared for in terms of their physical care. They weren't being touched, they weren't being interacted with. And the pediatricians were saying, you know, babies need to be held, they need to be walked, they need to be held in somebody's arms. And then the World War II, one and World War II studies were really pivotal in babies in orphanage about setting the tone for attachment theory. So Bowlby and Spitz and James and Joyce Roberts and all of them were looking at babies who were put in orphanages during the war. And they were found that even though they were physically being taken care of, there was a much, much higher death rate of those babies who weren't being interacted with. Next slide, please. More contemporary, some of you all might have heard of Ashley Montague. He made a big splash back in the 70s. I know that was a long time ago, but still he made a big splash about the importance of touch and the human significance of the skin. This made a big deal. This was a big deal when he wrote this book back in those days. And then Tiffany Field came along, a developmental psychologist, started off as an OT, and the founder of the Touch Research Institute at the University of Miami. She's still down there, although I think she might be sort of headed towards retirement. She's done a ton of work in this area and really her seminal studies have really brought attention to the importance of infant massage. So I'm going to use a lot of her work today. Next slide, please. So one of the first studies that she did was looking at massage on premature babies. Back in the 80s, I mean, we barely touched babies in the NICU, in the neonatal ICUs, right? I mean, they were considered, you know, hands off, and I think we still have a little bit of that today. But she did a study where she looked at premature babies, balanced them out for their size and their level of prematurity. These were babies who were out of the NICU, but were in what they call the grower nursery. So they still need to grow in order to go home. And she did this very simple thing where she came up with a 15-minute massage session. She had a routine that she created for this, but it was 3 15-minute sessions over 10 days. And in just that amount of time, these babies gained a significant amount more weight, were more awake, more responsive to the exam. This was done by research, the research team, and they were discharged 6 days earlier. So there was a potential for enormous cost savings in this. So this is, again, done by the researcher. This was a big deal study. This was like, wow, this is impressive. Next slide, please. She, so after that, lots and lots of studies have been done all around the world, finding similar types of results on premature babies, including finding things like they grew faster in length. They had their head circumference grew faster. They had decreased cortisol, less stress hormones that could be detected, better food absorption, which would of course explain weight gain, more responsive feeding behaviors. Look at that little sweet baby looking at that caregiver and smiling right back at him. And these similar responses occurred whether the baby was massaged by the experimenter or by a massage therapist or by a parent, and in some cases, grandparents and others. So that touch was really, really important. Next slide, please. She also has done a number of studies on other types of vulnerable babies, so cocaine exposed, HIV exposed, motor impaired infants. You can see that all of them demonstrated better weight gain, more maturity in their behaviors, more fewer stress behaviors, more interaction with their caregivers. So keep that piece in mind. And for infants of depressed mothers, we know that depression makes mothers less responsive, less sensitive, often they can be more harsh in interactions. And they found that babies of depressed moms who were massaged just 15 minutes a day for a couple of weeks, better sleep, less fussy, better play with mothers. So those babies, oftentimes infants of depressed mothers are perceived by their mothers as being more difficult. These babies then became easier to take care of. Next slide, please. In terms of benefits to the caregiver, the person who's doing massage, this is also really important work. So it's not a one-way street. She did some work during pregnancy and found that a couple of 20-minute massage sessions twice a week in comparison to a relaxation therapy group, that these mothers had less anxiety, better mood, better sleep, less back pain, lower stress hormones, fewer labor complications, fewer infant complications. That's pretty significant. Personally, I love massages, one of my favorite things to have done. But I think this work suggests, we should be thinking about this maybe more often for the moms that we work with. And then importantly, in terms of maternal depression, this is for mothers themselves who are depressed. If they were taught how to massage their babies and did it on a regular basis, they in fact had fewer depression symptoms. And again, these findings weren't just out of Tiffany Field's shop, but a whole systematic review published very recently found indeed that infant massage can actually help improve maternal depression symptoms and make the mother feel more like she's competent and skilled at taking care of her baby. And she's going to see the baby respond in a very positive way. Next slide, please. So again, as I commented earlier, most of the studies have been done on caregiver-infant interactions, but it can be found fathers can do this, grandparent volunteers can do this. There can be depressed grandparent volunteers who were in the nursery had better mood symptoms also. So there's something about doing that massage with that little baby that is beneficial for both sides of the dyad. And again, you'll see even a few months after sort of sessions, if you will, with massage therapy, and we're talking about babies 0 to about 6 months. Once they get to be a little bit older, they're harder to kind of contain, but the first few months, you'll see better eye contact, more smiling, more vocalizing, fewer avoidance behaviors, again, more relaxed babies, easier to take care of. Next slide, please. So what is this all about? Why is this work? Again, Tiffany Field proposes a couple of different mechanisms, biological mechanisms. Again, the pressure receptors in the skin impact the parasympathetic activity, the vagal nerve, which can bring the heart rate down, can even the heart rate out. And then that can also have an effect on cortisol levels, improving immune function, and also improving the neurotransmitters in the brain in terms of providing some relief for those stress types of situations. But it's important that there are techniques and there are strategies for doing massage. Many of you probably grew up with your parents rubbing your back at night before you went to sleep and that sort of thing. But sometimes if it's too light, it's actually stimulating. So the amount of massage pressure has to be fairly firm and moderate and consistent to be effective, at least in terms of the things we're talking about today. Next slide, please. Try and keep an eye on the time. I'm not going to go through techniques because I've got some resources for you. We don't have enough time to do all of that, but I'll do some very, very basics about, sort of the approach. One is as you can see from the studies, the sessions don't have to be very long. And you don't even have to do a full body thing. There are techniques for rubbing the head, rubbing the ears, rubbing the back, rubbing the belly, rubbing the arms and legs, all of that. You don't have to do all of that every single time. And certainly types of massage can be incorporated into babies' routines with the mother, and again, even in a NICU, even in a nursery. Again, firm, consistent pressure is important. A variety of strokes can be used. And one of my favorite outcomes, this is not necessarily dyadic, but belly massage for the baby can actually help with things like constipation. I love that. Somehow that just seems like a great benefit for massage for babies who get stuck, if you will. A lot of massage programs recommend use of some type of massage oil. We're not talking about adult massage oil. You shouldn't be using mineral oil or nut oils because those can be irritating, or they may cause some kind of allergic reaction. But you should use unscented, edible, plant-based oils. Usually we're talking coconut. I do have almond, shouldn't be there. Almond, olive oil, and some of those fruit pressed, there's lots of mango oil, that kind of stuff. It's not required, but.
Dr. Zena, you're on mute. You muted.
Sorry about that.
Okay, there you go.
I'm just using my hands too much. Okay. I think the magic, as far as I'm concerned, about why it's so great for the Dyad is that the parent is really able to look at the infant cues. Yasmin, I'm going to use you, Yasmin sent me a picture of doing some massage with her niece or nephew. I can't remember who it was. And the baby was just in bliss, and when you see that and you see the baby responding and relaxing, that's got to feel good to the parent. And it's important for the parent to begin to learn those cues. What do they squiggle around with and not like versus what do they like, and that sort of thing. So it really is improving maternal parental efficacy. And of course, you can always set it up with soothing music and make it a routine and that sort of thing. And that will help the child just kind of settle right in, and the parent as well. Next slide. So again, there are several infant massage programs out there. There was, again, a review of all those programs recently. There doesn't seem to be a clear winner for which one is the best to use. We need to keep in mind that the research is very positive, I think, but there's not longitudinal studies on this. So we're not really following kids who've been massaged when they're the first 3 months of life and out to their 13 or 20. It's certainly a culturally salient practice. So it's something that most parents are going to be receptive to, caregivers are going to be receptive to. And parents don't need to have formal training, but but these techniques can be incorporated into basic education for parents, either in the NICU or prenatally or whatever, so that they can begin to look to how to do that and various types of way of incorporating that. I think it should be part of the list of things that we talk with parents about and demonstrate for them if possible during the course of preparing them to be parents. I'm going to talk a minute. I'm going to go to the next slide because I think I have some lists. Yeah, so here's some lists for you that you might find interesting. The International Association of Infant Massage is probably the biggest organization that trains people to do infant massage. Loving Touch is the one that I did. It was about a 3-day training. It was fun, but it was still about a 3-day training to learn all the different skills and techniques and so forth. There are certifications in this for those who are interested. I don't know, I'll be perfectly frank, I don't know how many hospitals or how many practices incorporate infant massage. I hope home visiting does. We talked about it a long time ago in home visiting. It's obviously a natural place to talk about infant massage, but Training Grounds, which is in New Orleans, is now beginning to offer infant massage classes for parents, and this certainly can be done in a group setting. There's some very good websites out there that you can look to. I particularly like the AAP's website here, the benefits of baby massage. There's some really nice practical pointers as well as some examples of how to do it. That's pretty easy to access. Next slide, please. Okay, this is a picture of some babies who were in a group infant massage program that I did a while back. And you can see they're all happy little babies. It was a fun thing to do. It's a very upbeat and positive approach for helping parents learn to interact with and understand their babies. So I'm going to stop it at this point and see if anybody has any questions or comments. Oh, here's references for all of you who are interested in learning more.
Thank you, Dr. Zena. I'll ask, just for time's sake, just to hold the questions to the end, because
Okay.
we're going to move right into the case presentation. Thank you, Dr. Zena, for the presentation. Thank you, Yasmin, for presenting the case today. I'm going to hand this off to Jody for the wrap up and closing announcements, but we really appreciate y'all. Good job.
Thank you, everybody, for the discussion and the time. We're going to put the survey for the continuing education units in the chat. I'm also going to send out an email that has that link tomorrow. We'll send out the recommendations, and we'll also send out a copy of the slides. Our next session will be on July 23rd. And the focus is going to be perinatal mental health in Black women, presented by Courtney Malvo. So thank you so much for your time. We'll stay on in case there's a few additional questions. We'll also post the link to the didactic presentation recording on our website. So thanks everyone for your time, and let us know if you have any questions, and we hope to see you in July. Bye.